This is the first video for the integument system, which is part of Unit 12, but I separated the muscles from this um, system. I will say that at first it might seem weird to connect the two by the authors of the book, but as you know, during exercise, and especially intensive exercise, it's impossible, at least today, to divide the blood supply to the muscles and the skin. So when you say 85% of cardiac output goes to the muscles during high intensity exercise or maximal intensity, that includes the skin as well. So they are very much combined in a way. I won't go over the general information, and I want to focus on the main points, uh, kind of disregarding the obvious parts, hopefully. So, if we're talking about lesions, um, and we start with pressure ulcers, obviously ulcers are the result of an unrelieved pressure, in this case, a mechanical pressure, not physiological. It has no physical outlet, so the force has to accumulate somewhere, and then you get ulcers. Um, the Although moisture will help create ulcers because of the nature of fluids, uh, the majority of the point is mechanical. So high unrelieved pressure causes ulcers, which, as we've just discussed in the videos for the digestive system, may affect blood supply. One of the most common and first symptoms is redness that appears within hours, which usually does not have lasting implications within itself. Uh, if untreated, injury to the inner parts of blood vessels may occur, impairing the healing process, and may lead to the occlusion of the vessel. And of course, then there's different levels of decrease in oxygen supply, different levels of necrosis, inflammation, scarring, and so on and so forth. You can see that the discoloration of the skin differs according to the if the injury is superficial or not. Just a second. Sorry, I apologize. And of course, the worse it gets, the easier it is for infections and viruses and bacteria to influence the body. Then, when you have infection, fluids become pus. Pus is the combination of dead cells, viruses, bacteria, what they produce, all in one. And that can also cause discoloration, and then has usually a horrible, horrible smell. The more fluid the pus, the worse it is in content. Let's see. Of course, mechanical pressure can lead to pain. And the bigger the ulcers, the more change we have to psychological aspects, such as appetite, debility, and then also, of course, it can lead to physiological changes, such as renal insufficiency. In order to avoid these pressure ulcers, we need to keep the area moving, not let the pressure be focused on one area, because we're talking about high pressure areas. So movement, diet, hydration, all lead to avoiding these outcomes. Then if you have superficial ulcers, you have to dress them we want the dressing to be as straight as possible without any wrinkling, because that worsens the situation. Continuing to keloids and hypertrophic scars, very simple ideas. A keloid is an elevated, rounded, firm, irregular, claw-like formation. Basically, it's a scar of a sort, which margins that extend beyond the original injury site. Hypertrophic scars are erythematous fibrous lesions that are also elevated, but do not extend beyond the site of injury or the original site of injury. And both are the outcome of abnormal healing, obviously. If you have abnormal healing, then obviously the control of the normal healing and regeneration process is lost. Then you have fibroblasts and collagenous formation processes that take place and fill up the gap. You can see that the keloids appear within a year of trauma. The hypertrophic scars within 3 to 4 months thereafter, but can regress within a year. The major parts of the body that are at risk for the formation of keloids and hypertrophic scars, are the shoulders, back, chin, ears, and lower legs. You can see that between the age of 10 and 30, you have a higher likelihood of it appearing. When they're untreated, they become smoother, irregular in shape, hyperpigmented, meaning usually darker. They become harder and more symptomatic. And then you can see also there's a very beautiful. I mean, the photo is beautiful in how it shows it, but it's horrible for the person. There's a very beautiful photo, or very clear photo of fibrous claw-like prolongations that go in the book. It's across the chest. Pruritus, simply the idea of itching, is a symptom more than anything else. It's one of the major symptoms of most skin disorders, and it also can be one of the symptoms of a systematic disease, and it can be the result of opiate drug use. It can be localized or generalized and can change location, meaning it can spread. There is an interaction between the need to itch and pain. And itching has its own neural pathway to the brain, meaning that it affects the brain immediately and can have psychological aspects as well. Of course, treatment will have to address the origin of the itching itself, since it's a symptom and not a disease or condition. Okay, major inflammatory disorders. We will only address the causes. I'm not going to go in depth into the mechanisms. I think we've done enough of that throughout the course. The two most common terms when it comes to inflammatory disorders of the skin are eczema and dermatitis. And then usually before the word dermatitis, you have phrases or terms that give away the origin or the mechanism or the cause. So we have a very broad family called the allergic contact dermatitises. It's a general term for any contact by the skin to an allergy-causing substance. Usually a person needs to be hypersensitive to it, or the chemical substance has to have a certain component that you're allergic to. Then if you have a delay response, you'll see the symptoms after a few hours. The pattern of distribution is usually very helpful to understand the origin. Then if you remove the cause for the allergy, you usually resolve the problem. Then at first, usually the symptoms include itching, swelling, redness, and vesicular lesions. Uh, and of course, you can notice that the responses are immune-based. Then we have irritant dermatitis, which is not an immune-based response. It can provoke systemic involvement. The severity is directly dependent on the concentration of the substance. Obviously, higher concentration means worse irritation, and longer time of content also worsens it. You remove the irritant, and you got most of the solution for treatment. Then we have atopic dermatitis, common with hay fever or asthma background. It has an immune background as well to it, and is more common in infants and children. The next subtype is stasis dermatitis, very common in the area of the legs, and it's the result of venous status or edema. Then you can also associate it to different traumas and impairments of venous blood flow. Symptoms by order of appearance include erythema, pruritus, scaling, petechia, hyperpigmentation, ulcered lesions, and notice that they focus on the ankle and the tibia, as we said, the legs. We have seborrheic dermatitis, a common chronic inflammation of the scalp, eyebrows, eyelids, ear canal, nasolabial folds, axillae, chest, and back. When it appears in infants, it's known as the cradle cap, and this is the idiopathic form, as well as the lesions appearing and disappearing from childhood to adulthood. Psoriasis. Psoriasis is a disease that never goes away. Basically, it has a very simple mechanism to it. You have regeneration over regeneration of cells, meaning that the cells never mature, and immature cells replace them all the time. In the majority of the cases, the proliferation causes the tissue that is affected to thicken, because although the cells are new, they are accumulating more than you are destroying them or dying. Now you have an increased metabolic demand, and that means that you have to create more blood vessels. This in general leads to lesions that will appear and disappear periodically. We're not going to go over the subtypes. I think that is enough for our needs. Then we can talk about pityriasis rosea, which is a self-limiting inflammatory disorder of young adults, and it will occur usually in the winter, but not only. The cause is suspected as a herpes-like virus. It begins as a single lesion known as the Herald patch. The patch at first is circular, pink, 3 to 4 centimeters in diameter. So that's about 1.5 about 1.5 inches, and is commonly located on the trunk. Within 3 weeks, secondary lesions develop on the upper extremities, include the upper parts of the extremities. Um, they may become oval and rarely will appear on the face. Um, and the pattern is uh, characterized or described as a dropping pine tree. So you have, kind of lines that go downwards. Scales uh, might emerge from the margins, forming a collaterate pattern in more advanced situations. And then the most common symptom is itching. Symptoms also may include headaches, fatigue, and a sore throat. Okay, slide 42, lichen planus is a benign autoimmune inflammatory disorder of the skin and mucous membranes. Um, it is linked to the hepatitis C virus. Uh, Lesions at first are non-scaling, violet in color, um, 2 to 4 millimeters in size, so not very big. They have a flat top, uh, polygonal shape, usually appear on the wrists, on the ankles, lower legs, and genitalia. The newer lesions that appear with time are more pale pink, but might change and evolve into dark violet. If they are persistent and they don't go away, they become usually thicker red and hypertrophic. Um, you also might have different shapes that might include oral lesions that are lacy white rings. So, although on the lips they will have a bit of a different shape. And then you can develop mucous membrane lesions on the penis and on the vulval vaginal areas. Um, Although uncommon, they might ulcerate with an increased chance in that case for cancer. It might be accompanied by the thinning and splitting of the nails, uh, as well as shading of the whole nail itself. The lesions may last up to a year, but are usually self-limiting. That's about it. Then we have acne, which is a painful uh, topic for a lot of people. Acne has several sub types that we'll go over really, really fast. Basically, uh, we're all familiar with acne that comes and goes throughout life, even in adults. When we talk about the vulgaris subtype, we're talking about an inflammatory disorder of hair follicles. Excuse me, I'm a bit under the weather. It is very common in adolescents. Um, then we can talk about another subtype, which is acne rosacea, which is a chronic inflammation of the skin in the middle-aged adult. It has within itself 4 subtypes, which are idiopathic. Um, in the later case, we're talking about suspected decreased innate immunity. You see that the lesions are located mostly in the middle third of the face, the forehead, the nose, the chin, and the cheeks. It's associated with chronic inappropriate vasodilation, leading to flushing and sun sensitivity. And it can lead to the accumulation of sebaceous hypertrophy, meaning sacs, underskin sacs that secretes what we call sebum, which might accumulate to a sebaceous cyst in some cases. It might cause fibrosis. Then it might cause, the accumulation on the area of the nose that makes it kind of bulbous and increases its size and volume, and it's red and just loses its clean, shiny, and smooth appearance. It may include eye disorders that could lead to visual impairment. Then alcohol and hot drinks worsen the severity. Hot drinks, because of the heat, causes pus and fluid accumulations to rise. And then alcohol causes changes in blood flow, and that doesn't help with acne. We can talk about an autoimmune systemic inflammation disorder that also might be deeper and go to the bloodstream, but usually starts at the integument system, which is lupus erythematosus. Usually at first, as I said, it's limited to the skin, but can progress systematically. Then we can talk about vesicubulous disorders, which basically form blisters or sac-like, pouch-like areas that fill up with fluids. Kind of resembles a bubble in a way. It can have an autoimmune background or not. It can also include the oral mucosa membranes. And then with an autoimmune disease background, it will destroy the cells of the system itself. We're not going to go over each and every one of the subtypes. I don't see a reason. I think that the process, the principle, is more important than anything in this case. Then you can see on slide 52, talking about erythema multiforme, which is a syndrome of symptoms that include skin and mucosal membrane inflammation. It's associated with an immune response to a drug or a specific microorganism. In some forms, you have edema develop in the superficial dermis, superficial layer of the skin. These lesions are relatively easy to identify. They have a bullseye or a target sign resembling look. The rings are basically the presentation of edema and inflammations with gaps within them. Within 3 weeks, the lesions appear in groups as plaque can develop as well, even without, in some cases, the lesion. So the combination of all of those is possible. They may be accompanied by the sensation of burning and itching. They usually heal within 4 weeks. And the most common forms are the reaction to drugs. Symptoms may include fever, headache, malaise, sore throat, and a sore cough. And in worse conditions, erosions may develop that obviously will lead to bleeding and necrosis at the end. Symptoms may also appear in the mouth, air passages, esophagus, urethra, and conjunctiva. Severe forms may cause renal injury and disease, as well as affect the respiratory tract. Obviously, you would have to affect the bloodstream for that, and it at this point it's systematic, right? And of course, severe cases or forms may be fatal. Okay, vascular disorders, pretty simple, I think, in principle. If we look at angiitis, we're talking about the inflammation of the blood cell or vessel wall that might result in a bleeding aneurysm. Uh, Occlusion with ischemia is also possible, as well as infection. All of these things we've talked about. That's why I'm going through them really fast. Um, Symptoms may be self-limiting and localized, but of course will mainly affect capillaries, because when we're talking about the skin, obviously blood vessels become smaller. Um, they can also include multiple organs and be generalized. In that case, it gets worse. One of the things that might happen is the deposit of immunocomplexes in small blood vessels as the main cause. Um, it's a response to toxic drugs or allergens. Of course, it activates the immunocascades that we've learned about with a very high and dominant presence of leukocytes. Um, and of course, it gets worse when it's systematic with hemorrhages, meaning you have bleeding and loss of blood. Hives is a circumscribed area of erythema or edema of the superficial dermis. Lesions are associated with type 1 hypersensitivity to drugs, certain foods, systemic disease, cold, and heat. Um, in this case, you do have fluid leaks from vessels that appears as wheals, welts, or hives. Uh, they can cover the whole body at times. They usually resolve within a day until new lesions appear. Um, when it's chronic, it's either idiopathic or with an autoimmune background. Systemic sclerosis, I think that we can go over it really fast because we've learned about sclerosis. In this case, it's specific to the skin. We're talking about an autoimmune disease that is associated with vascular, immunologic, and fibrotic processes. It's idiopathic. Um, it involves the connective tissue of the skin and multiple organs. You have massive deposits of type 1 collagen and fibrosis with inflammation. Um, and then we can use the CREST acronym to represent the symptoms, sorry. And you can take a look at it. Um, we can see that usually the lesions focus on the face, hands, neck, and upper chest, but they're not limited to those areas in every case. The skin becomes very hard, hypopigmented, meaning it becomes lighter. You can talk about taut, shiny, and tightly connected to the deeper level skin, so it becomes harder and less fluid, less flexible. And when that happens, it makes your skin look like a mask in a way. And then the tightening of the skin around the mouth makes it harder to talk and limits the mouth. Um, the nose is also, the tension goes up, making it like a beak-like nose, and more shiny. And it can progress to other organs, leading to failure, for instance, of the kidneys, of the lungs, and the heart. just a bit more. We don't have much more conditions, which are pretty simple. Hair disorders. We can talk about alopecia, which is the loss of hair in general. Usually it's so hair has several phases of growth. When we're talking about the growth phase of the follicle, which is disrupted for any reason, that is the main reason for alopecia. Um, any reason that will do that, you can see that hormonal imbalance, iron deficiency, chemotherapy, malnutrition, compulsive hair pulling, which has a psychological aspect to it, autoimmune diseases, chemicals like sprays that you might, or hair color that you might put on it, dye, and of course any kind of mechanical pressure that is applied. Um, then you see the autoimmune form, the alopecia areata, um, which causes round patches of hair loss to appear on the scalp, and that happens usually very fast. Hirsutism is the abnormal growth and distribution of hair on the face, body, and pubic areas uh, in a male pattern, but it happens in women. Um, and then they also have a recession of hair on the frontal temporal area that accompanies that, mainly due to hormonal imbalance, and then possibly cancer. Then we have nail disorders. We have paronychia, an acute or chronic infection of one of more of the finger's cuticles. Um, it's accompanied with painful inflammation, uh, usually post minor trauma. An abscess, which would include pus, can develop with the need to drain it to prevent the pain. And then the nail plate itself is usually asymptomatic, but the area is tender with swelling, uh, which are usually more severe forms of it. Um, then we can talk about onychomycosis, which is a fungal um, infection of the nail plate. The nail turns either yellow or completely white. It is elevated and has uh, keratotic debris. So that's all for the integument system. If you have questions, let me know.